Hi everyone, welcome to PHD113 Lecture 3. In this lecture, we are going to discuss more about dosage forms. At the end of this lecture, you should be able to describe the types and uses of pharmaceutical dosage forms. Let's go through some of the common terminologies that we are going to use in this lecture as well as throughout the course. So we have discussed about the definition of drug in the previous lecture. Drug is actually defined as an agent intended for use in the diagnosis, treatment, cure or prevention of disease in either man or other animals. Dosage forms is the means or forms whereby the drugs are being delivered to the site of action in our body. Pharmaceutics is referring to the scientific and technological aspects of the design and manufacturing of dosage forms. So drugs that we commonly use nowadays are very rarely administered as a pure chemical substances alone and are almost always pre-formulated as a medicine or a preparations. So we call it as a dosage forms. So let's look at a simple graphic over here. So drug, we often call it active ingredient within a dosage forms. So within the dosage forms, or the layman term, we call it medicine. Apart from the active ingredient, which is the drug, we also made it together or combine the drug together with other excipients. Sometimes the more layman term, we call it additives. These additives have their specialized functions. Some of them, for example, they help to solubilize or make the drugs more soluble in a liquid preparation. It also may be used to preserve the medication so that it can have longer expiry date. It may be used as a coloring or it can be used as a diluting purposes. So when the drug and the excipients combine together, we call it a medicine or a dosage form, where it delivers the active drug or the active ingredient or the drug to the site of the body. So why do we need dosage forms? We need dosage forms basically to help us to deliver an accurate drug dosage very conveniently and safely to the patient. So we don't want to ask the patients, hey, after you go home, you have to weigh 50 mg of powder, yeah? Then you dilute in 200 ml of water, then you drink. So that will be super not convenient for the patients. And if you ask patients to do so, most likely majority of the patients don't really take the medications. So that's why we need a dosage form where it can pack all the medications together or all the drugs active ingredients in one single, for example, a pill, where the patients can easily just pop into the mouth and take the medications accordingly. Dosage form is also used to protect the substance from destructive influences of the atmospheric oxygen or humidity. So we want to basically prevent the drugs from oxidations or hydrolysis due to the atmospheric oxygen and also the humidity in the environment. The dosage form also is used to protect the drug substance from the destructive influence of gastric acid after oral administrations. So the drug are supposed to absorb from the intestine. So we don't want the drug to actually, after going through the stomach, and it will be destroyed completely by the stomach. So none of the drug will be available to be absorbed from the gastrointestinal tract, right? So the dosage forms can also use to protect the drugs from the gastric acid. The dosage forms also can mask the undesirable taste of drug substance, particularly those medications which are bitter. So we want to mask the bitter taste of the medication. Dosage form can also be used to provide a clear liquid preparations of drug substances. Either it can be insoluble or unstable in the desired vehicle, meaning the dosage forms can be available as a liquid preparations. So dosage forms can also use to design in such a way that we can provide a rate control drug actions, meaning that we may design the drug to ask the drug, hey, please release slowly for the rest of the 12 hours in a consistent concentrations. So we call it controlled release dosage forms. So we can actually pre-program the medication or design the medication in such a way using special type of dosage form. We can also design the drug in a special type of dosage form where it can insert the drug into body orifices, for example, the rectal or the vagina, right? We can also place the drug into bloodstreams or body tissues, for example, like by injections, is a kind of dosage forms. Dosage form can also provide optimal drug action through inhalation therapy. Okay, so this type of dosage form we call it inhalers. So we will talk about the different types of dosage form in the subsequent slides. So there are many ways actually on how we can classify dosage forms. One of the way that we use in this program that you attend is that we classify dosage form according to physical form, the physical appearance of the dosage forms. There are also other ways that we can classify dosage form, for example, on how we administer the dosage form. Is it by oral? Is it by parenteral, meaning by injections? Is it by inhalations? So we can classify according to the route of administrations. But in this lecture and in the program, the Diploma in Pharmacy program, we classify dosage form according to their physical appearance or physical form. So there are four main types of dosage forms. Okay, the liquid dosage form, as the word implies, it appears as a liquid formulation. The semi-solid dosage forms, half solid, half not solid. So we will talk about in terms of the examples in a short while. Okay, so of course there's solid dosage forms and also gaseous dosage form. Okay, so let's go through what is liquid dosage forms. So liquid dosage form is more commonly known as solution, if you are aware. So it is formulated for either oral and also can be external use, meaning on the skin. Yeah. So examples of oral dosage forms, oral liquid dosage form include syrups, elixirs, linctuses, suspensions, emulsions. We'll look into each of these examples in a short while. For external liquid dosage form or topical liquid dosage form, examples like lotions, liniments, paints, goggles, and also ear drops. So oral solution is basically a liquid preparations that contain one or more chemical substances dissolved in a suitable solvent or mixture that is actually mutually miscible solvents, meaning you don't see any solid floating inside the liquid preparations. All the solids or all the drugs are dissolved completely in the solvent, so it appears as a clear oral solutions. So there are different types of oral solutions in the market. Yeah? One of it is called syrup. So when we say syrups, we can expect that the solution actually contain a very high content of sugar. That's why we call it syrup. Elixir basically is a clear and flavored liquid, contain a high amount of sucrose, which is another form of sugar, right? And also ethanol. Linctus is also another type of liquid preparations where when we use the word linctus, we always referring to the liquid preparation that is used to treat cough. Okay, so we use the word linctus. Linctus is a liquid preparation whereby it contains also high amount of sucrose and also alcohols. So each of the dosage forms that we are going to discuss in this lecture contain both the advantages and also disadvantages. It is very important for us to understand their advantages and disadvantages so that we can make recommendations to the doctors and also patients based on their needs, right? So in terms of oral solution, the advantages are, of course, it is more easily to swallow compared to, for example, tablets or pills, capsules, okay, which may be a bit too big for children or elderly who has swallowing problems to swallow the solid dosage forms like tablets or capsules. So oral solutions, the another advantage is that the medicament is more readily absorbed from the gastrointestinal tract because it's available as a solution already. So it is actually more easily absorbed. And oral solutions are much more easy taking for the children or elderly and also other patients that got swallowing problem, which I mentioned earlier on. So oral solution is actually a homogeneous, meaning very clear solutions whereby there is no solid suspending in the preparations. So it provides a very consistent dosage whereby we don't need to shake the bottle in order to dispense the medications. Okay, so we don't have to advise the patient to shake the bottle before using. So the disadvantages of oral solutions include, if you know, oral solutions usually come in quite a big bottle, right? And some of them come in a glass bottle, which is very bulky and much more difficult to transport compared to tablets or capsule, right? They are more light. Oral solutions are also more susceptible to microbiological contamination because of the sugar content and also the water content in the preparations. These are very delicious food for the microorganism. Oral solutions are not suitable for drugs that are with unpleasant taste, particularly those bitter drug. We don't want to formulate as oral solution because it becomes too bitter for the patients to take the medication. The oral solutions also, because we need to pour out, right, before administering to the patients, in terms of the oral solutions, the way of pouring out or the way of syringe out the medications according to the prescribed dosage is actually very depend on how skillful the carer or the patient's parents is. If they can measure the amount of drug correctly, of course the dosage will be correct. If they are not too skillful and then they measure the amount of drug wrongly, then the drug dosage or the amount of the medication that the patient should take is actually wrong. So for oral solution, this is one of the disadvantage whereby we need to train or we need to educate the patients on proper withdrawing or proper measuring of the milliliter of the oral solution so that the amount of drug is correct. Okay, so the second type of oral solutions or liquid dosage form is what we call suspension. So unlike oral solutions, suspensions contain one or more insoluble medicaments that actually disperse in a vehicle. Vehicle basically means a liquid preparations or a liquid form that actually as a carrier for the medicament. So we call it vehicle. So the suspension usually contain insoluble medicaments whereby they suspend or they disperse in a vehicle. So we can add in other additives like preservatives, flavors, colors, and also stabilizer to actually make the suspension more stable. Other than for oral suspension, actually suspension can also be formulated for other dosage form like for injection, aerosol or inhalations, topical applications for external applications can also be formulated as suspension, not just for oral only. So because the suspension contains insoluble medicaments that are suspended or dispersed in the vehicle, so when we ask the patients, when we dispense the medication to patients, we must instruct the patients that before you actually pour out the medication, you have to shake very well first in order to redistribute the medications completely throughout the preparations. If not, all the medicaments, when they are not used, they will start sediment at the bottom of the bottle. So when you pour out, you are not pouring out the drugs, yeah, you are pouring out only the vehicle. So in that case, we must ask the patient to suspend or shake well before using any suspension. So emulsion, if you know, one of the very famous examples of emulsions like Scott's emulsion. So emulsion basically consists of two layers of liquid preparation actually. One of it is oil, the other one is water. So we know that by common sense, oil and water are not well distributed together, right? But in pharmaceutical field, in our field, actually we can make oil and water mix well. That is by adding surfactant or emulsifying agent. Okay, the emulsifying agents can actually distribute themselves throughout the oil droplets at the outer layer of oil droplets, and this actually stabilize all the oil droplets in a very small forms, and they distribute evenly throughout the water. Okay, as shown at over here at the picture over here, you will see that the oil droplets are well distributed throughout the vehicle. So this is the microscopic appearance of the emulsion, but when we see through our eyes, we don't see such a way. We don't see the oil droplets. What we see is only a white appearance. Okay, so this is basically an emulsion. So examples of topical liquid dosage form, for example, like lotion. So lotions can be in the form of solutions or suspensions or emulsions. Basically, lotions have multiple uses. Okay, external use, of course, which it can be used to as antiseptics, which it kills some bacteria. Parasiticidal also soothing purpose. Okay, liniment, basically it appears more oily form, whereby it contains drugs like methyl salicylate, which we use to rub into the skin, okay, for muscle pain or strains or injuries. So another example is what we call pain. Pain is seldom used nowadays, but there's only one or two examples of pains, like the candid pains, whereby we can apply on the topical skin. It will leave a layer of the drugs. Okay, after the vehicle evaporated, it will leave a layer of the active ingredient or the drugs on top of the skin, which usually used as an antiseptic, or it can be used as analgesic, which is pain relief, or astringent. Astringent means if there is bleeding, there's open wounds, it can actually stop the bleeding. Right? Another topical liquid dosage form example is what we call gargle. I think everyone know gargles, right? Gargle is basically a solution, an external solutions, which we can just cleanse our mouth, either cleanse our mouth, or it can also use to treat the infections of the throat, or when we have sore throat, we usually gargle, okay, in order to make the throat feel better. So gargle in Malay we will call kumur, right? So we don't swallow the preparations. After we gargle, we will spit out the liquid preparations. Okay, eardrop, I think everyone aware what is that. Is basically a drop preparations where it is used to instill into the ear, and it treat basically problems inside the ear. Most likely it's due to infections. Yeah. So the eardrop can appear as a solution, meaning it's a clear solution, or it can be a suspension, meaning the drugs is not soluble in the vehicle. It actually disperses throughout the vehicle, which we call it a suspension. Examples of solid dosage form, the most common one is actually like tablet and capsule, powder and granules, suppositories and pessaries. We will go into each of these examples in a short while. So tablets and capsule is basically the most popular way of delivering drugs for oral use nowadays. I think you may have the opportunity of swallowing a tablet before, or a capsule before. So again, there are advantages and also disadvantages associated with tablets and also capsule. So the advantages is that, as you are aware, tablets and capsules, they are much more lighter, right, compared to oral solutions or liquid preparations. They are much more easy to handle and also identify. Okay, usually it comes in a strip pack. Okay, they deliver more accurate dosage, meaning after we pop a pill, it will administer exactly the same dosage or the same amount of drug that we want let's say for example paracetamol 500 mg, each of the tablet will contain exactly 500 mg. Okay, so let's say we supply a paracetamol syrup or paracetamol suspension to a mother. So the drug dosage actually, how accurate is it depends on the skill of the mother, whether they can measure the amount of drug correctly or not. So in tablets and capsule, we don't have such issues associated with the amount of drug or the drug dosage. It is always the same as long as we choose the correct tablets for the patients, which is like, for example, paracetamol 500 mg, it is always 500 mg. Okay, so that's why we call why we say that more accurate dosage is one of the advantage. It is more stable than liquid preparations because, as I mentioned earlier on, the liquid preparations are much more susceptible to microbial contamination due to the sugar content and also water content in the preparation. While this does not happen in the solid dosage form like tablets or capsules, they don't contain any aqueous in the preparations. Okay, so the next advantage is that it is very easy to ship. It's much more lighter than compared to the oral solution. Yeah? Of course, tablets and capsules also consist of disadvantages. One of it is slower onset of actions. Why is slower? Because after we take the pill, okay, it has to go through the stomach. It will need to start dissolving, disintegrate, and it takes some time to transport into the gastrointestinal tract, then only it will be absorbed. Okay, so unlike the oral solutions, it is actually available directly as a liquid preparation, so the absorptions will be fast. They don't have to go through disintegration, dissolving, etc. Yeah. So tablets and capsules are not suitable for patients or the people with swallowing problems. Okay, so oral solution will be a much more better options for patients with swallowing problems. So tablets is basically solid preparations that contain either a single dose of one or more active ingredients. Okay, one tablet, sometimes it may contain 2 or 3 medication in one single tablet. Yeah, that's very common. Of course, most of the time, one tablet also, it will contain only one active ingredient. Okay, but bear in mind, one tablet can also contain 2 or 3 active ingredient or 2 or 3 drugs in one single tablet only. So tablets are normally prepared or manufactured by compressing or molding uniform volumes of the powder particles together. So as you can see over the picture here, so when the machine compress the powder particles, it will form a tablets. Tablets can be sugar coated, yeah, film coated, or enteric coated. Okay, so enteric coated is basically a special type of layer that actually layered on the external of tablets, and enteric coated is designed to protect the drug from gastric acid. Okay, so we want to make sure that the drugs will penetrate the go through the gastric acid safely. Then when it can't go into the gastrointestinal tract, then only it will disintegrate and absorb. Okay, so there are different types of tablets. Okay, so they are dispersible, meaning the tablets, when you put into water, it will disperse, right? Chewable tablets, sublingual meaning the tablets we can put under the tongue and it will dissolve slowly. This is commonly used to treat patients who have heart attack problem. So if I've seen in a movie before, so when usually somebody has got a heart attack, then they will take out a small bottle whereby the tablets is very small and they get placed under the tongue. Okay. And another examples of tablets are like lozenges. Lozenges is like gum type of tablets where it is usually used to treat throat infection or sore throat, whereby you can suck, okay, suck the tablets or the lozenges. Okay. Another type of examples of tablets is what we call modified release tablets, whereby it is specifically designed in such a way that the drug will release slowly over a relatively long period of time in a sustained form. Okay, so meaning usually like, okay, please release in 1 mg, okay, per hour continuously for 12 hours. So the scientists can actually design the tablet in such a way. So we usually call it modified release. Capsules are basically solid preparations that is used for oral administrations, and it has a hard or a soft gelatin shell, as you can see over the picture here. Capsules are easy to swallow, and they are very useful to mask any unpleasant taste of the drugs because it contains in a hard shell, right? Hard shell. So it basically can cover, if the drugs are very bitter, it basically can cover the unpleasant taste. Soft shell capsule basically usually the inner contain oil preparations or oily drugs. That's why it appears as very jelly. It looks like a jelly. So another type of solid dosage forms, examples like powders and granules. Okay, so as you can see over here on the picture here, powders are basically the solid material which is in a finely divided state, or the granules actually comes in bigger size, yeah, bigger size. So all powders and granules are no longer, it's not that common to dispense powders or granules directly to patient anymore. Not common doesn't mean that we don't have at all. We do have, but it's not that common. Yeah, usually powders and granules are the raw materials which is used to formulate subsequent dosage forms like solutions or suspensions or tablets, right? So powders can either be for internal use or external use. Example of internal use, like usually it contains active ingredient and also other diluents, other excipients like diluents such as sweeteners, okay, and also dispersing agents. As I mentioned earlier on, powders are rarely being dispensed nowadays. Yeah, so the powders can be undivided form, meaning we call it bulk powder. It comes in maybe a one tin, like a milk powder, yeah, or a divided powders, maybe meaning the powders are individual wrapped in a small packet. Okay, so we do have powders preparations or powder dosage form in the market, but quite rare lah, quite rare. Like the examples over here, as seen over here, Smecta. Smecta is basically a drug used to treat diarrhea. If you have diarrhea, particularly for small children, yeah? So doctor may give Smecta. Powders can also be used for external use, meaning for the skin. So usually it contains one or more substances in fine powder that is used to treat a variety of skin conditions. Examples like antifungal powders for the athlete's foot. Okay, athlete's foot is a kind of fungal infection on the foot. Okay, tuck dusting powder for prevention of skin irritations. So the last examples of dosage form, solid dosage forms, are actually suppositories and also pessaries. So both these form of dosage forms, their shapes actually appear as bullet shape, yeah, bullet shape. So they are intended to deliver drugs into either the rectum. If it is delivered into the rectum, we call it suppository. If it is delivered into the vagina, then we call it pessary. Okay, it can be used for both systemic and also local drug action. Systemic means it once we insert into either the rectum or the pessary, insert into the vagina, the drug will be disintegrate and absorbed from the blood vessels. Okay, and then it will run through the body to create systemic drug actions. Local actions means that, for example, the rectum. Some patients may have piles. Okay, if you have no idea what is piles, or in other terms we call it hemorrhoids. Okay, hemorrhoids. So we can insert the suppository into the rectum, basically to treat the local pain, to create pain relief from the hemorrhoids. So it can be used for systemic effect and also local drug effects, local drug actions. Suppositories are usually made using either a metal or plastic mold, yeah, as you can see in the picture. So here you will also learn how to make suppositories in one of the course in your semester 3, yeah. when you learn about solid dosage form. Okay, so this the central picture shows the examples of how suppository look like. So suppository is basically intended for rectum administrations, while pessary is intended for vaginal administrations. Okay, please don't confuse, although their shape looks very similar. Okay, so next we go to the another type of dosage forms. We call it semi-solid dosage form. So semi-solid dosage form are basically designed to administer drugs or for topical application, meaning on the skin, apply on the skin. So basically we can use it to treat wounds or any conditions associated with the mucous membrane. So they can provide local therapeutic emollient or protective actions. Emollient means hydration, okay, or for the drugs to penetrate through the skin, okay, or the mucous membrane and then take action from there. Examples of semi-solid dosage form is like creams, ointments, gels, and also paste. So creams basically provide preparations that are miscible with the skin secretions, right? So usually creams can have the effect of protections of the skin, or it can be therapeutic or prophylactic purposes. Okay, and creams are used when comparing creams and ointments. Cream are less greasy. Okay, less greasy. When we apply, it's much more easily absorbed into the skin. Okay, so we can use it for protecting the skin. We can use it for therapeutic purpose. Therapeutic means to treat the skin condition. Maybe there's infections. For prophylactic purpose, like preventions. For example, we want to go to beach. We need to apply sunscreen, right? Sunscreen as a cream form, as a prophylactic purposes, as a prevention purpose. Okay, and creams is used when we don't need any occlusive effect. Occlusive means there should be a layer, a very thick preventive layer, like ointment. So when we apply ointments, when we run under the water, it's much more difficult to wash off as compared to creams. When we apply, it's faster being absorbed, and when we wash under the water, it's actually easily being washed off, right? So when we say occlusive effect, is not easily being eliminated, yeah, from the skin. Creams are usually soft and easily spreadable and less greasy compared to ointment. So ointments are more greasy to creams because the oily contents of the ointments are higher content compared to creams. So the base of the ointment is usually anhydrous. Anhydrous means it does not contain any aqueous or water, okay, or oil, okay, and it is immiscible with skin secretions, meaning it don't penetrate. It is not miscible. It don't mix well with our skin secretions. Yeah. Medicated ointments are used for treatment of skin infection, inflammation, and also pruritus. Pruritus is a condition of the skin where it is associated with itchiness, right? Non-medicated ointments are commonly used for emollient or lubricating purposes. Gel and paste are another examples of semi-solid dosage forms. So gel, I believe everyone know, is like jelly-like semi-solid system that it may contain dispersions of small or large molecules of aqueous liquid vehicle, and also with addition of gelling agent so that it appears as a gel. Medicated gel can be formulated for administrations of various routes, okay, meaning it can be administered in many ways, either into the eye, into the nose, into vagina, into the rectum, okay. So gel can be formulated as different way that it can be administered to different location within the body. While paste is rarely used nowadays also, paste is basically ointment, okay, ointment, and we add drug solids into the drug ointment base, so that become paste. So paste is basically the dispersions of high concentration of solid into the ointment base. Okay, so it is stiffer compared to ointment because it contains higher amount of solids, right? And it is applied on the skin, right? And they will remain in good place, okay, which can effectively absorb the serous secretion, meaning if there is any wounds or secretions from the open wounds, we can apply a paste, and then the preparations will absorb any secretion from there, right? Okay, so the last type of dosage forms that we are going through in this lecture is what we call gaseous dosage forms. So gaseous means gas. Okay, so we have mainly two common types of dosage forms that we can deliver the drugs in gaseous form. One of it is what we call inhalers. So the aerosol inhalers delivers the aerosols of drug dissolved or suspended in the propellant. So when we press, so the propellant will come out, and then the patient will inhale, okay, and then the drugs will administer into the lungs. So the inhalers are usually used for patients who suffer from respiratory problem like asthma, okay, like asthma. So sprays is another type of dosage forms that actually administer drugs in gaseous form. Okay, so sprays basically packaged in pressurized dispenser, as you can see in the picture here. So when we press out, the sprays will produce droplets of very, very small size. Okay, very, very small size. So these droplets contain medications. Yeah, medications. So sprays can be used for surface disinfectant, meaning to clean the surface from and eliminate any microorganism. Wounds are also burn dressings for dressing purposes. So the take-home message after we have gone through so many types of dosage form is that you must remember that one single drug, a drug can actually available in many different dosage form. As you can see in the picture over here, the drug name, this is basically the brand name of the drug, which is called Voltaren. The actual drug name is what we call diclofenac. So the diclofenac sodium. So Voltaren comes in a gel form, a suppository form, a tablet form, and also a ampule. This ampule is basically for injection purpose. Yeah, the ampule that we need to break open, and then we use syringe to withdraw out the solution. So it's basically intended for injections. Okay, so just Voltaren itself, it comes in 4 different types of dosage form. So imagine that when the doctor just write, okay, supply Voltaren 50 mg, and then he or she, the doctor, did not specify which dosage form to give the patient. So how the pharmacist or the pharmacy assistant is supposed to decide which one to give, right? We have no idea. So it's very important that the prescriber, the doctor, need to specifically specify which dosage form of the drugs that we should supply to the patients. Okay, we as pharmacy personnel, either a pharmacist or pharmacy assistant, we ourselves must understand the advantages and disadvantages of each of these dosage forms. So in case that the doctor asks for okay, so let's say the doctor did not write on the prescriptions on the dosage form, so the doctor asks, oh, patient has got pain on the muscle, lower leg muscle. So which dosage form should I give here? So of course, lower leg, we want to apply something on the muscle, right? So the best options of dosage form may be to supply the gel, the external preparations of gel form, so for the patients to apply on the muscle. So we must understand the different types of dosage forms, and also the advantages and disadvantages. Then only we can make recommendation to the doctors and also the patients. Okay, so with that, I would like to end the lecture recording by recommending you to further reading the pharmaceutical practice book that I have actually shared in the U Future as well, the ebook that I've shared. You can read on chapter 29. So the ebook that I share is actually much more updated versions of the book. If you prefer to read the physical book, okay, the physical book, some people prefer physical book, you can get it as well from you can borrow it from the library, but it comes in the older version. It is the 4th editions. The ebook that I share is actually a 5th editions. So for 4th editions, then you have to refer chapter 21. Okay, So with that, I would like to end this lecture recording, and happy learning.